Well, we've heard the CDC recommendations to stop the spread of the COVID-19, among them social distancing and good hygiene. But how is that being put in practice in our jails and prisons?
A coalition of health and criminal justice reform advocates argue it's not possible under current conditions and are asking for the governor to intervene to protect workers and inmates. WMAR 2 News' Abby Isaacs joined their virtual press conference today and explains what they want to see.
They want to reduce the amount of people behind bars to allow for social distancing. That includes releasing nonviolent and child offenders. They say it's all to prevent an outbreak like what's happening in Rikers Island in New York City right now. And they say it's not just for the inmates' safety, but for the staff and the general public as well.
COVID-19 is a death sentence for those that are inside.
Martina Hazelton is worried about her husband's safety as an inmate at a facility in Cumberland.
He suffers from hypertension, so he's a vulnerable part of this population.
They see what's happening with the spread of COVID-19. They hear the recommendations and can't follow them.
Everybody in there is scared. They're all scared. They feel like they're sitting ducks.
She says following the CDC's guidelines for social distancing and hygiene is almost impossible.
Imagine yourself walking into a walk-in closet in an average size home. That's the size of a cell. And that's being shared with two people.
Many prisons and jails have a copay for soap, and soap is a limited commodity. And of course, many ban the use of hand sanitizer because it contains alcohol and can be a substance of abuse.
So today, a coalition of public health experts and criminal justice reform advocates came together for a virtual press conference, asking Governor Larry Hogan to do 5 things to contain and prevent the spread in the state's prisons and jails. Among them, reducing the amount of people behind bars by stopping new admissions and releasing those who can be safely released into their communities, prioritizing children and the most medically vulnerable adults.
There is a child who is 36 weeks pregnant. There is multiple children with severe asthma who have to see pulmonologists.
There are many people in our places of correction who can be safely released without any risk to public safety.
They're also asking for improved safety conditions for those who remain incarcerated, which includes health screenings and sufficient hygiene supplies. They say it's not only for the inmates' safety, but for everyone.
Risk is to all of us. Pandemics and outbreaks inside of prisons don't stay in prisons. We have staff members, case managers, and correctional officers who work on the units.
In Baltimore, Abby Isaacs, WMAR 2 News.
Well, the governor's office tweeted out information from the Department of Public Safety and Correctional Service and says that they have temporarily suspended intakes and is using discretionary release mechanisms. The Department of Juvenile Services is taking some similar measures.